challenges, cost and fragmentation that could hinder adoption, and what the future might hold. First, we'd like to thank our sponsor, Optum, for making this virtual briefing possible. Before we begin, we're going to do a little bit of housekeeping. If you're having any trouble with audio or visuals, please refresh your browser. This is also an interactive event, and we welcome your questions. You can submit them in the Q&A box that's just above the slideshow.
That's wonderful. Thank you so much.
Make sure you hit submit. And please tell us your first name and your city so that we can give you a shout out if we use your question. We're also going to be doing polls during this. The questions will pop up on our screen the questions will pop up on your screens as we're talking. So please be sure to answer and hit enter so that we can hear from you. And you can connect on us on social media. Our hashtag is NextEra. Now we're going to have some remarks from Robert Musselwhite, the CEO of Optum Insight.
Thank you for joining us. More than ever, Bloomberg Live briefings are not only tremendously informative, but essential. And I'd like to take a minute to share my thoughts on today's topic, the next era in healthcare. Even as we navigate one of the most challenging times in healthcare with the COVID-19 pandemic, we have an enormous opportunity in front of us to fundamentally change how people are cared for in the future. This is especially true around telehealth and virtual care. While last year only 1 in 10 patients participated in a virtual visit, the health system is now waking up to the fact that virtual technology is not just for times of crisis. There's broad recognition that it has multiple applications, benefits both patients and providers in countless ways, and is highly effective. This is something many of us have known for some time. A few years ago, when our client, the University of Pittsburgh Medical Center, wanted to expand access to in-home care for cardiac patients, they deployed our Vivify remote patient monitoring technology. Here's what they discovered. 1, when Medicare members enrolled in Vivify, they were 74% less likely to be readmitted to the hospital within 90 days. 2, patient compliance reached over 90%. And 3, patients gave the program very high marks, giving it a 93% satisfaction rate. Today, it's clear patients and providers are quickly embracing virtual technologies. In fact, Frost & Sullivan forecasts a 7-fold increase in telehealth by 2025, including remote devices and wearables. Our advisory board research confirms this, with about half of all hospitals expected to invest in remote technologies over the next 18 months. This rise in telehealth will have huge impact on our ability to connect people in care, especially in the home and in underserved rural areas. It also reflects a broader need for something even more fundamental, a fully connected health system, able to leverage this new technology and vast data to its fullest potential. So if I had to describe the next era in healthcare in one word, it would be connection, bringing people and technology and information together to help individuals better manage their health. This is one of our top areas of strategic focus here at Optum. We envision a health system where clinicians are fully supported with data-driven insights, where health plans can seamlessly and accurately manage costs, quality, and utilization, where employers can support a healthy and productive workforce, and where consumers are empowered by digital technology to live healthier lives. We know this is going to take a lot of work by everyone across the entire health system. But recently we've seen what is possible when the private sector, government, and researchers come together to advance our understanding of human health and develop new solutions to advance it. The path forward to a connected health system requires deep investments in advanced technology, the robust sharing of healthcare intelligence, intense cross-system collaboration, and relentless innovation. We believe that is how we will drive better health outcomes and experiences at a lower total cost at a societal scale for years to come. Thank you and enjoy today's briefing. Healthcare intelligence.
Thank you so much to Optum Insight CEO Robert Musselwhite. And now we're on to the next section of the next era in healthcare. So please join me in thanking our speakers here who are with us today. We have Dr. Amy Abernathy, FDA Principal Deputy Commissioner for Food and Drugs. We have Jason Gorvick, who is the Chief Executive Officer of Teladoc Health. And we have Mei Kwan, who's the Executive Director of the Center for Connected Health Policy. Thank you guys so much for joining us.
Thank you for having
So I
me.
think that we're going to start with May. Thank you so much. So we're gonna start with May. Telemedicine has been with us for as long, really, as telephones have been with us. Doctors have always been reaching out to their patients in remote areas. We've even had people on the space station get medical care. But it has been a slow ramp. So tell us when healthcare, when technology, when telehealth really started taking off, and where we were through the end of 2019 before coronavirus changed our world.
Thank you, Michelle. So I liken COVID-19, the impact it's had on telehealth, to similar to an actor who was unknown before and suddenly was cast in a Marvel franchise movie film. So telehealth before COVID-19 had been slowly gaining traction, but it hadn't really quite reached that point where it was well known, widespread, and greatly utilized. COVID-19 has really changed that landscape, and now it's become, proliferated throughout our society here. So many more people know about it. I've been doing this for 10 years, and I had family and friends who were confused about what I did. Now they're familiar with telehealth. We're seeing it used in like a multiple places, in the home, in different clinics and hospitals that hadn't used it. And the reason for the sort of slow progression of it at first was the technology. The technology was not quite there yet. But really, in the last few years, it had actually gotten to the point where you could use the technology to deliver the services in these multiple places. But the policies weren't really there to really facilitate that utilization. So you had these policies in place that really impeded and limited how telehealth could be used and where it could be used and who could use it.
So great, thank you for that. That segues nicely into some questions for Dr. Abernathy. Of course, the FDA's main role in our country is to ensure the safety and health and the efficiency of the healthcare the medical system. But there have been regulations that have been changed in recent times, given coronavirus, to help expand the use of telehealth and to roll it out to more people. More things are being covered. The FDA is allowing things for psychiatric care and other types of things. So tell me, do you think that the FDA was a little bit slow in terms of the regulatory process? And now that you see what's happening, are you happy with what you've been observing?
So, first of all, the COVID-19 pandemic, this is terrible for all of us, really has given us a bright spot of learning and being able to think about what works. And so, and one of the bright spots itself is telehealth. From the standpoint of the FDA, our responsibility is to protect and promote projects.
All right, I think that we're having a little bit of trouble here, Dr. Abernathy. We're not actually hearing you, so apologies for that. We will work it out on the technical issues on our side. So, but we can switch it over. I think that to Jason Gorvin, while hopefully you can talk with our tech folks, to Jason Gorvick, it seems to me like a lot of us have learned a phenomenal amount since coronavirus hit. There was widespread belief that we couldn't work from home, for example, and millions of Americans, millions of people all across the world have been asked to stay home. For you, it's been exactly the opposite. You guys were asked to really phenomenally step it up. So my question for you is that when did you know that your entire world was going to be upended by this? And how prepared were you to step into that chasm?
Yeah, so I appreciate it, Michelle. Thanks for having us and for the question. It's interesting because with a global presence, we actually have physicians on the ground in China as well as in Europe, especially in Spain. And so we had a sort of earlier insight than many in the US about the progression of the disease. At the end of January, we started being in contact with the WHO and the CDC and we started to see the impact that this could have. We became prepared over the course of those couple of months, but I don't think anybody really understood the ramp that it would take when it finally hit the U.S. And so in the middle of March, we saw literally overnight our volume double. And last year we already did 4 million virtual visits over the course of the year, and that will more than double this year. So we saw daily volume more than double. And fortunately, we build our technology systems to really 10x our peak volume at any given time. And so that actually worked incredibly well. The technology held up very well. What it took a little bit longer, about a week, maybe 10 days to do, was ramp up our physician capacity. And so we saw a few days of slower than expected and slower than acceptable time to connect with a physician. But by the time about 8 or 9 days was over, we were back to pre-COVID service levels of connecting someone with a doctor in a matter of minutes. And at the same time, we had providers in the market who all of a sudden were forced to embrace virtual care as a means of survival, quite frankly, economically, and a way to connect with their patients. And so we were able to onboard thousands of physicians onto our platform to enable them to connect with their patients over that period of time.
It is really amazing how both pieces of this are coming together. We're seeing the consumers embrace it because they have no choice, and the doctors embrace it because they have no choice. So it's going to be so interesting to see how that plays out. Let's go back to Dr. Abernathy and see. I apologize for that technical difficulty, but if you wanted to finish up, we lost you at about when you were saying what the FDA's mandate is in order to ensure the safety of the American population.
So our mandate is to protect and promote public health, and we do this really by the development of medical products. So drugs, devices, biologics, and how does it fit into this story? Practically speaking, for example, one of the things that needs to happen is clinical trials. And in clinical trials, it's important to keep patients safe. And then they need to go a series of clinical trial visits where they interface with their clinicians. Telehealth has become a really important mechanism for remote monitoring of patients on clinical trials.
Oh no, we seem to have lost you again. Apologies for that. So I do not know what's going on there. But so I was going to go to a poll, but I think that perhaps our technicians might be busy trying to help Dr. Abernathy's connection. So instead, we're going to go on to our next set of questions. So I was personally surprised to learn that that ER visits are well suited for telehealth. I always thought if you're going to the emergency room, you need to see a doctor in an emergency, and they might need to set your arm or give you a test, something like that. But there are all these different areas that have really expanded. So maybe we'll start with Jason. You can tell us what areas are really booming when it comes to telehealth. What is an area that maybe people aren't aware that they can go to telehealth to get quick and excellent access? And then perhaps you can follow up on that.
Mm-hmm.
Yeah, I think that's actually the most underappreciated area with respect to telehealth is the breadth of clinical services that are available. We see clinical use cases ranging from pre and post surgical visits to oncology follow-up visits, all the way to telepsych, telestroke, and certainly mental health care is one of our biggest areas and fastest growing areas. Telepsych in the emergency department, where someone needs a psych consult, they need to speak with a psychiatrist. But of course, every ED in the country can't staff a psychiatrist. And so that lends itself incredibly well. But it's also longitudinal care where someone has a long-term relationship with a therapist and or a psychiatrist in a virtual relationship for regular check-ins using multiple modalities, everything from text to chat to phone to video, and really using them interchangeably as necessary for both scheduled visits as well as on-demand care. And so, again, I would say we see demand today from everything from orthopedics to cardiology to oncology. Certainly dermatology lends itself incredibly well. And so I would say that the truth is this has forced multiple specialties all across the spectrum to embrace virtual care. And I don't think it's going back. What we're hearing from all providers of different specialties is that telehealth is now a permanent part of their practices.
So, Dr. Abernathy, that you were actually discussing this. That's one of the things I wanted to talk about. Another area where there's been innovation, where telehealth is making a difference, is in the clinical trial world. So if you wanted to continue with that, but I think you're going to have to keep it short because of the internet connection.
It might go away. So importantly, in clinical trials, we need to keep people safe. So historically, we have had everybody come back for many visits, but now we're starting to see the use of telehealth to allow people to stay at their home and interface for those many different clinical trial visits via video with the clinical trial teams. Allows us to collect safety data, allows us to keep patients in trials, even in a time like the pandemic, and keep studying new medicines. And it's one of the places where we've seen telehealth have a huge role.
I think it's so interesting because the issue of access is critical here. Now, obviously, people who are in clinical trials, generally, these are our sickest patients and most vulnerable. And so being able to get them to be able to safely see their doctors is such a huge benefit in this time. But then there's also these other layers of issues in terms of it's really helpful. You don't have to drive to the doctor. You don't have to pay for parking. You don't have to maybe get on a bus or a subway. On the other hand, you also need to have internet access. You need to have a computer. So maybe you can talk to us a little bit about disparities in healthcare. Are we going to see that telemedicine is going to exacerbate some of these disparities that we're seeing, especially because coronavirus in particular has hit our communities of color much harder than other communities? Or is it actually going to be a beneficial move? And then we can maybe go to Jason and Dr. Abernathy.
Mm-hmm. It's actually going to be both. And I think COVID-19 has really highlighted that, in that telehealth, people can see right now, it is a great benefit. It is a great tool to provide these services to those vulnerable populations. But you do have certain segments of the population who may not have, the robust enough connectivity, or maybe they don't have the devices on their end at the home, like a laptop or a smartphone. And that is a question I think policymakers are grappling with. It's like, how do you ensure that you do not have that digital divide there? One of the things that there is a lot of concern about, you mentioned it, Michelle, like communities of color, different cultures, seniors who may have like issues in how to utilize the technology. I know from like my own experience, like my parents are seniors and they've had like a lot of their care switched over to telehealth now. They would probably not be able to like operate the equipment if I was not there assisting them with it. So how do you address those issues? So there are a few things that the government has tried to address, like such as the connectivity issue. In the CARES Act, there was funding to the FCC to help facilitate some of that equipment issue and providing equipment to their patients. And also they've also had a program for connectivity in which they would help like rural health clinics get access to broadband in order to like facilitate telehealth. But that is like a major question now going forward, that if we incorporate telehealth more into our health system, what do we do in addressing those issues in order to make sure nobody is left behind?
Yeah, I'm going to switch up the question to Jason a little bit, because May, you touched on this issue of whether people can do telehealth, especially seniors and others, without someone there along to help them. And as Jason pointed out earlier, we are seeing a huge influx of new people trying this out. And that raises the question of stickiness. If someone tries this, how likely are they to come back? So I'm wondering what you're seeing on your end, Jason, and what you think going forward.
Yeah, so about 60% of our users in the first quarter were new to telehealth. They were first-time Teladoc Health users. And we see with tremendous member satisfaction rates, really net promoter scores that are more like consumer digital products than they are like healthcare. We see tremendous repeat utilization because, number one, it's convenient, it's responsive, it's high quality, and number two, really most importantly, it resolves their clinical needs and actually provides the care that they need. So we see a lot of first-time utilizers coming on through this pandemic. Awareness of telehealth has massively expanded. The data I've seen is that just over a matter of a few weeks, it went from 50% consumer awareness to 75%. That's an unheard of ramp for anything. And I would say that, for a long time, we've always held the belief that virtual care is the great equalizer. We serve populations in commercial populations, Medicare populations, Medicaid populations. And we find that seniors today are comfortable doing FaceTime with their grandchildren, and you don't need a lot more technical knowledge to be able to use virtual care and take advantage of it than to be able to do something like that. So we believe that with smartphone proliferation comes access to the necessary base technology. And a lot of the hospital systems we're working with are providing peripherals that are very easy to use, connect via Bluetooth or even via cell connection, so that there's no configuration necessary to be able to take advantage of the technology.
So I'm very interested to hear what Dr. Abernathy thinks about the persistence of telehealth. But before we do that, we're going to see what our audience thinks. We're going to go to a poll now to see what you guys are expecting in your own life in terms of access to the telehealth. So hopefully that poll question will pop right up on our screen. Alrighty, I do not know if it's popping up on your screen, but is not popping up on my screen. So we will just segue straight to Dr. Abernathy and see what you think about the future of telemedicine, telehealth, if it's something that's going to be sticking with us here in the future.
So I suspect, as you've already heard, there has been a massive ramp up, and we are going to continue to see telehealth persisting. I also think that the jury is still out. The question was whether or not this is going to accentuate disparities or start to relieve us of many disparities. And as I think about this from the clinical trial perspective, it increases access of people in especially rural and remote areas to clinical trials because of the increased chance that people who might not have been able to come back to the doctor where the clinical trial is being held can now participate. However, importantly, clinical trials are a space where we need to make sure that people are being kept safe. And so we need to make sure that we understand two critical things. Is the role of telehealth in the clinical trials and the clinical development space something that we can maintain while also maintaining safety? And the second is clinical trials are an important way of collecting the data to understand the safety and effectiveness of a medical product. And is the data that's collected of adequate quality to be able to serve as the information we need to make those judicious decisions? Those are two critical things that we're going to need to understand for the persistence of telehealth in the medical product development side, so clinical trials.
Yeah, I think that's a critical area as well, because we need to have consistency and high quality data. So if we can even get better results with telemedicine, then that could really expand our use of all these things, not have people go to the doctor as often. You're sick, not feeling well, you need to have people help you. That could be really an incredible advance when it comes to clinical trial work. So I see that you guys all did actually get the poll question and I did not. So here we go. How has the COVID-19 pandemic changed your use of telemedicine? So our big winner was, I think I'll use it more, but I haven't had the chance yet. That's more than a third of you have said that. So interesting. I think that maybe we skew to healthy. Maybe the group of us just haven't needed to get that much to telemedicine so far in this outbreak. Then our next group was, I have increased my use of telemedicine. That was 30%. And then a full quarter was, I was never a regular user and I don't see it much in my future. And then 7% regular user before, and not much has changed. So thank you all so much for jumping into that. I really appreciate that. It's very interesting to see what you guys all are thinking about it. So interesting. May, I'm wondering if you can talk to us about where we're going from here in terms of what we need from technology, what kind of new devices we need to further telemedicine. And Ellen from Massachusetts sent in a question about this. She asked how strep throat can be diagnosed with virtual medicine. It's interesting for me, that touches close to my home because strep throat hit my family just last week. So I had a telemedicine visit and an in-person visit. But what else do we need to have in order to further this industry?
So I think really one of the important things are going to be the policies that are in place. So what we saw with COVID and I mentioned earlier, what were the barriers to the proliferation of telehealth before had been the policies that had been in place before COVID-19. When COVID-19 hit, what you saw were a lot of governments, both on the federal and the state level, issuing waivers to relax some of those policies to allow telehealth to be used more widely and in more places and by more providers. Those were temporary, though. So in order to encourage the use of telehealth to continue once we get past the pandemic, the policymakers are going to have to decide which one of those policies to keep in place. Because if we revert back to pre-COVID-19, then you're going to have that situation of where telehealth can only be used in limited places. And one of those limiting factors was where the patient was located when the telehealth interaction took place. Not a lot of people were paying for those services when they were taking place in the home. That changed temporarily on COVID, but you take that away, then you suddenly have people needing to go back to a clinic in order to receive telehealth services and for a narrow scope of services. Now, the question about strep throat, I'm not a clinician, so I think I'm probably not the best person to answer that. Maybe Dr. Abernathy or our other speaker more suited to answer that particular question, how you use telehealth to treat it. But as far as, to encourage the continued utilization of it, expansion of telehealth, you definitely need to have those policies in place. And right now, that's the big question mark because all of these relaxations were temporary. So what's going to stay around and in what form are they going to stay around?
I know that there is some legislation up on Capitol Hill that they're talking about putting some of these policies into place, especially, for example, paying the same amount for a telehealth visit as an in-person visit. So I'll ask Dr. Abernathy, how do you feel have you heard about the quality of care for Americans when it comes to telehealth? Do you have any insight as to whether or not you think that this has been a good thing, and if it's something that maybe we're going to see continued telehealth, or is there still a little bit of information that needs to be gathered, like it is with clinical trials?
So first of all, I'll put on my clinical hat. I'm an oncologist by background. So I think about this in terms of telehealth helping me interface with my patients in a way that at a time like COVID-19, I might feel fearful that I don't have as much contact with them, especially at a time when a cancer patient needs to be seeing their doctor. And so I expect we're going to have learned a lot. I expect that learning will persist. We will also be able to discriminate better when does telehealth have a role, and perhaps even roles that we hadn't expected before, as well as when does it really need to be the in-person visit with your doctor. The other thing that I think we're going to get better and more practiced at, and goes back to your strep throat example, is how to partner telehealth with, for example, laboratory visits, so that you have the laboratory data that you need also to complement making the clinical diagnosis. So I think that story is going to continue to evolve, and we have a responsibility of essentially collecting the information from the pandemic right now to tell us what are the judicious times that it's really smart to prioritize telehealth, and where do we need to continue to refine it. In terms of your point about potential policies for the future, CMS helps to oversee the decision-making on the policy side as it relates to payment for telehealth. But I do anticipate that practically going into the future, CMS and also all across government, we're going to be stopping and looking at that information and saying, what did we learn from COVID-19 and make sense to persist telehealth into the future?
Yeah, absolutely. There's no doubt about it that the entire world is going to change because of this, and especially medicine and healthcare delivery has to keep up. So again, going back to Jason, who has been your entire foundation. I know that you guys have been building for this for years and years. So for it to all come to fruition is an amazing thing. And the fact that you were able to get up to that kind of speed and ramping, we've seen that there's supposed to be 1 billion telehealth visits this year, and as many as $250 billion worth of healthcare services could go virtual, helped along by this coronavirus pandemic. But it's also fundamentally shaking the foundation for physicians and providers. So we've gotten a bunch of questions, like, for example, John from Wisconsin and Jorge in Peru are asking questions about how is this going to affect doctors? So is it possible for them to continue with healthcare? Are they going to be able to, keep doing it from their homes, or will they have to go to an office where they can guarantee the privacy of their patients? And also, are they going to be a lone wolf or a partner in this process, or is the individual provider just going to go away entirely?
Well, I don't think there's a scenario where the individual provider goes away. The physicians and hospital systems that we talk to see telehealth as a complement and a component to the overall healthcare delivery. It's a tool that improves efficiency, opens up access, and drives down the cost of care. But it's not a replacement for a physician. It's a tool that the physician can use in order to deliver care that is, quite frankly, on the consumer's terms. And in many cases, it's preferable for the physician, who can manage their schedule more dynamically and not be sort of beholden to the large institutions quite as much. But across the board, this is a complement. And I think one of the most important things is that telehealth isn't separate from the healthcare system. It has to be deeply integrated into it, both from a data perspective as well as a continuity of care perspective. And we've spent a ton of time making sure that that happens by working with hospital systems, working with the large payers, working with employers and their benefit plans, working with lab companies. I'm sure Dr. Abernathy is seeing an influx of home testing, both devices as well as clinical tests, which I think really has an opportunity. And we've now seen, with some of the home swabs for COVID testing, I think that has the opportunity to really open up a new wave of what telehealth can do in a really high quality, efficacious manner. And I think the FDA has been doing tremendous work partnering with the healthcare industry to move that forward.
Well, I have to say that coronavirus has been devastating to the entire world. We've lost millions of people, millions more are infected, millions are going to be infected going forward. But there are some silver linings here, and you guys have pointed it out beautifully. We are getting innovation. We're using new technologies to reach people, hopefully in a more efficient and effective manner. Hopefully we'll be having cost savings, getting clinical trials done more quickly and easily. So there is a silver lining here. And thank you all so much for coming. Dr. Abernathy, Jason May, thank you for being with us. We really appreciate it. And now we are going to segue over into our second part of our briefing here. And it's going to be led by my colleague, Emma Court. And I will hand it over to you. Thanks, Emma.
Hi, Michelle. We'll be continuing the conversation now, talking a little bit more about how technology is and can be leveraged as part of new models for care. Our panelists today are Sanjay Fernando, who's a senior vice president at Optum. He leads the artificial intelligence and analytics platforms team for Optum Enterprise Analytics, supporting the design and development of leading-edge AI models and analytic tools for the enterprise. We also have Maury Greenberger, who is the Senior Director of Informatics for HIMSS, a global cause-based not-for-profit organization focused on realizing the full health potential of every human everywhere. And Giresh Nadkarni, who's a nephrologist and the Clinical Director of the Hasso-Plattner Institute of Digital Health at Mount Sinai. He's also the health system's COVID Informatics Center co-chair. Thank you everyone so much for being here with us today. I thought we might start by talking a little bit about specific examples from your careers as to how technology can create change within the US healthcare system. Why don't we start with Girish, and then we can move on to Mari and Sanji.
Thanks. Thank you, Emma, and thank you for having me on. So I'd like to give an example from the post-COVID era. So Mount Sinai was called the epicenter of the COVID epidemic in New York City, and many of us around the healthcare system actually realized the need for data analytics and technology to improve outcomes in these patients. Because first of all, this is a new disease. We didn't know very much about it, so there was an opportunity for us to learn from data. And the second of all was that there was an opportunity for predictive models to be deployed in clinical care and make a change in the in-hospital outcomes of these patients. That was the reason the Mount Sinai COVID Informatics Center was formed, where a number of people from the Hasso-Plattner Institute of Digital Health, the Department of Medicine, the clinical decision support team came together. And what we decided to do was we decided to aggregate data from around the healthcare system in order to have all of the data of patients in one place so that we could learn from it, and then we could deploy predictive models in clinical care. Mount Sinai very fortuitously and very in a very forward-thinking manner, had put a system into place led by David Rich, who's the president of the hospital, Matt Levin and Robbie Freeman, where clinical models could be rapidly translated into clinical care and providers could be informed. So right now we have models running for prediction of mortality or death in patients who are going to be intubated or other outcomes. So this is a very concrete example in which electronic data can be harnessed and the power of it can actually be used to change people's lives in the hospital. But another example I also like to give is that since this is a new disease, since there's data available, we can learn more about how the disease progresses in people, what are the risk factors for complications are. For example, under the leadership of Dr. Valentin Fuster, who's one of the cardiologists at the Mount Sinai Hospital, we looked at patients who got blood thinners in the hospital and found that they had better outcomes as opposed to who did not get blood thinners. And that ties in with a lot of existing evidence that COVID may not just be a disease affecting the lungs, but is more a multi-system disease which affects the blood vessels and causes clots. And that's why giving blood thinners obviously needs to be tested in clinical trials, but may actually lead to better outcomes in this patient. So that's a very, very concrete example from the last 3 months where the power of data and analytics and digital health in general can be harnessed in order to change lives in the very, very short term when people are in the hospital.
Certainly a great contemporary example. How about Mari? Do you want to chime in here?
Sure. So absolutely. I mean, health, IT, information and technology, I think, got an extraordinarily robust boost in terms of the amount of adoption and implementation when meaningful use, which was a major overhauling policy that was enacted over a decade ago. And obviously, the use of health IT standards. So it's wonderful to have, technology, but if it's not implemented correctly, there's not the use of it can only go so far and the benefits can only go so far. So I would say health IT standards are critical. So to provide that common language and the set of expectations to enable interoperation or the talking and receiving and communicating appropriately between systems and devices. So I would say that's number one. Obviously, when you have an EHR and you implement it, you want to ensure that your market supplier is using the appropriate standards to ensure the movement and the data exchange is happening appropriately and effectively. I'd also say the use of health information exchange entities or organizations. So what I mean by that, obviously health information exchange is a verb, but can also be a noun. So these are entities that are essentially unbiased data trustees within the community, so they can manage and provide secure digital exchange of medical, behavioral, and social service data amongst and between providers, and also with the patients, right, to help get that information where it's when and where it is needed at the right time. So ultimately improving the health outcomes of patients in the communities and the regions to which it serves. So those are just some sort of basic, technology, what we talk about day in, day out as examples that are always going to be sort of there, and obviously leveraging platforms like EHRs is a part of that. I also want to highlight too, it's an emerging technology, and it was wonderful to hear the panelists talk about telehealth and also the potential use of apps and getting more engagement with the consumers and direct to patients. So there is something called blockchain technology. It is a form of distributed ledger technology, or DLT. And essentially what this kind of technology, especially blockchain, it describes a chain of data of transactions, and they're linked or essentially chained together by cryptographic signatures. So, and it's stored in ledgers, and essentially it's transparent and essentially, like if you look at a Wikipedia page, I mean, it's a immutable, trusted source that everyone can see. It's supposed to be transparent, and really what it is, I mean, as a consumer, you don't really know what blockchain is. It's essentially, though, it allows you to have greater control and access as an individual, as a patient, for instance, around your medical records and who you want to share it with. And if you want to share it with, a caretaker or anyone who's a part of the care team, right? So this is also a technology that is emerging. Obviously, there's some stronger use cases, certainly, that are emerging, much around supply chain management, whether it's around medical devices. There's also a lot of movement. Again, this gets back to the telehealth around credentialing. So obviously, Jason from Teledoc talked about, trying to ramp up physicians and onboarding. So there's a licensure and credentialing component that's behind there. So for instance, blockchain could serve as a conduit and a catalyst for those kinds of challenges. So I'll stop there.
Right. Yeah. And I think, what you're speaking to is sort of this increase in use of sort of health record technology, among physicians and health systems, as you sort of talked about a little bit in the beginning of your remarks. And I think, Sanjay has a really interesting perspective, sitting on a different part of the sort of healthcare system. I'd love to kind of hear his thoughts on how, new technologies can be used in his space.
Yeah, thank you. My breakthroughs that I've been able to be a part of have primarily centered around the use of artificial intelligence. And so when we think about artificial intelligence, it's been around for many years. I think it was coined in 1960s at Dartmouth. But what we're really at a point today is enjoying some of the benefits of some real material changes in how we can use it in more complex settings. Today, or even 4 or 5 years ago, we started to see really amazing breakthroughs driven primarily by deep learning. All of a sudden, we were able to automatically tag ourselves in social media, or you saw these amazing breakthroughs in self-driving cars. And it begged the question for us at Optum, how can we take advantage of these breakthroughs? Even in healthcare, we saw real big transformation through today around how we classify and categorize medical images, whether they be X-rays, MRIs, other medical imaging, and other signal data. And so those breakthroughs are really interesting to us as well, but we don't operate a lot of medical imaging practices or capabilities. And we ask ourselves, how can we transform our business with artificial intelligence? What we do is a lot of administration. We support lots of very appropriate business processes that help us ensure appropriate levels of reimbursement, help us understand the complexity of care, help submit and manage the revenue cycle for providers. And a lot of that entails reviewing documents, reviewing medical charts, to match up sort of the level of utilization with the level of care and the appropriate reimbursement. And in that area, we've applied some really advanced technologies to read in medical charts, images of medical charts. Sadly, we still receive some via print and fax, and allow us to classify them or extract information from them that are necessary for this billing process. So it's somewhat patently unsexy sometimes, but we are using some really amazing breakthroughs, convolutional neural networks on text and images of documents that allow us to really try to get to approval. We're never declining or denying anything with these machine processes, but many times if both parties agree on the level of reimbursement, we should get to yes as soon as possible and reduce the sort of abrasion and improve the timeliness in how we deliver and pay for care.
Yeah, I think your mention of, fax machines highlights something that I think many of our attendees may be sort of mulling over right now, which is, we're talking about all this cutting edge technology. We're talking about AI and, deep machine learning and things like that. But a lot of people don't necessarily see that in their own experiences, with the U.S. healthcare system. Can we talk a little bit about, the challenges that come up when you talk about healthcare in this extremely regulated environment? I thought maybe Mari would have a really great perspective on this just to start off with.
Yeah, absolutely. I think, I'm of course, a patient. I'm a caretaker. I'm a mom of 2 kiddos. I fully see the challenges firsthand, but obviously where, challenges have been there and are pervasive. I think one that's also, I like to think, an opportunity as well is we talk about interoperability a lot. And I think that, in general, this country has been built, we're essentially a quilt filled with different patches, different squares, and different capabilities. And, the piping looks and feels somewhat different, but we make it work for that moment. And obviously policy has also been a carrot and stick. So, it's like an old house where you continue to put on new renovations, but it's not the full blueprint, right? So we're really just trying to fix and modify over time. And I would say, there's pros and cons to that. Certainly, I think there's a lot of innovation, a lot of ingenuity, and obviously competition, right? Where companies want to try new things, try new approaches, and perhaps they're not always what's best for the bigger the region, or when you're not always thinking about interoperability with the community-based organization down the road, that's fulfilling social service needs. I mean, we just don't think about it that way. We haven't. I think COVID has really brought into light so many of these challenges. It's exacerbated so much of the gaps, right, in terms of this basic ability to move data and information where and when it's needed. And certainly now more than ever, public health organizations and entities have not really had an opportunity to be modernized the way that some other sectors of our ecosystem have. So certainly, when it comes to COVID, our public health officials and entities at the state level, the national level, they all need different information for reporting capabilities. And the way in which, for instance, that information moves is not very seamless. And that there's a huge work burden on some of these, the provider institutions and folks that really should be tending to patients who are sick, but instead need to be working on, what way can I get this information to fulfill some need? So I think in general, interoperability isn't going to go away as a challenge. I think it's just, there are so many really exciting efforts going on. And I think, tons of initiatives, which we don't have the time to go into, but there has been a lot of movement in this area to try and get that, interoperability quilt, if you will, that patchwork together and be more cohesive. Obviously, 21st Century Cures, it's a huge federal policy that main purpose of it was to increase innovation and competition, to reduce burden and increase and advance interoperability, and then of course promote patient access. So, you then have policy having expediting and catalyzing some of this work as well, which is great. But then, everyone's working to address and fulfill what could be a future law or regulation that they need to fulfill. So everyone, again, is working in not necessarily an orchestrated or concerted sort of unified approach. So there's pros and cons, to the world we live in, certainly.
Right. And I think when you speak about interoperability, I thought your metaphor was a really good way of illustrating it. Of course, at the very basic level here, we're really talking about, when different health systems don't speak with each other, right? I think we have actually a really good slide illustrating how, patients may encounter some of these challenges. So hopefully we can get that up on the screen here. I was wondering, Girish, if you might have some perspectives on this, in the contemporary COVID setting. Could you speak a little bit to this? I mean, did you guys find this was a challenge in trying to use data and technology to meet the sort of problem at hand, or was it a fairly seamless process because you're, this sort of top-notch health system?
So I completely agree with Maurice's points that interoperability is one of the major challenges, and there are several initiatives and efforts starting to do it, to try to address it. But even within a healthcare system, the data is siloed to some extent. But now, because of COVID, a lot of those barriers around the data came down because people realized the importance of utilizing data to save people's lives. And the silos started to be unsiloed, for lack of a better word. And when people saw what we could do with this integrated data and the sort of this holistic approach where all of the data on one patient, electronic, biochemical, could be integrated and used for risk prediction and risk stratification, I think this could set an exemplar and a tipping point because, yes, COVID is a major emergency and has affected millions of people, but there are emergencies going on in our daily lives, cancer, kidney disease, heart disease, that are killing people as we speak. And data is one of the answers to help us address those emergencies as well. So I think if you put that in perspective, taking the lessons that we've learned from COVID in sort of unsiloing the data and the value of data to be used for future sort of integrated research and clinical care and getting answers to clinicians very quickly in a easy to understand and actionable format. This example could be applied to any sort of chronic disease or any acute disease in the coming future. So I do think that while this has been a great tragedy and a great public health emergency, there are lessons that we could take from this and apply not just to our healthcare system, but to our society going forward about how we manage to treat and diseases. But there's a small point I'd like to make, which is, I think, important. As a healthcare system in the US healthcare system, we do very well treating people who are sick. What we don't do well is figuring out when people get sick and maintaining health. So I do think that data and a lot of the things that have been talked about, telemedicine, wearables, artificial intelligence, can actually be used to keep people healthy so that we don't have to come to a point where we're treating a sickness and or trying to cure an illness. And a lot of our effort in the future is also spent on keeping people healthy.
Really interesting point. Now that we're speaking about these issues of interoperability, let's go to our poll question. We have a poll here asking, who should be responsible for ensuring different health technologies like electronic health records are able to share information with one another. So the different options are the federal government, electronic health record companies, healthcare systems, patients themselves, or third parties. So we'll let people start voting on that. I'm curious if any of our panelists have a perspective on this question as well they'd like to talk about while people vote.
It might be all of above, I think in that regard, we all have to work together on this. I think the federal government could provide the leadership that enables folks to convene and come together and align on things. We absolutely need the health record companies who I think are continuing to make investments there to support that. But it's also people and patients. Blockchain was mentioned earlier. How much in the next 5 or 10 years will we each individually begin to really know and understand and own our own personal health record? So I think many of those constituencies need to come together for this to be really successful over the long term.
That's really interesting.
Yeah, I completely agree with that. Sorry, Emma.
I was just going to say, I think most of our poll answers are in here, and so taking the lead is actually the federal government with 36% of the vote. After that, electronic health records companies. People may have just voted based on the order here. Then it goes to healthcare systems with 21%, patients with 12%, and then third parties 3%. So yeah, does anyone have a kind of a different perspective on this? Maybe a contradictory one.
Yeah, this is Mari. I would just say this isn't surprising. That doesn't surprise me. I hope that if we were to take this poll in a year, patients would be a lot higher. I think there's an opportunity for just, again, continuous education and access and just learning, right, as a consumer of all of this technology. I think we've had a tremendous growth trajectory as it relates to all of the different apps and how to get involved and be an engaged consumer of your health. But I think that, I agree, it's a combination of, it's quite frankly, all of them. And I think that there needs to be, I think places like the federal agency, like Office of the National Coordinator, they can help set that roadmap and help sort of guide. But again, this is definitely a combination of private, public, market-driven, effort. I don't think it can just be just the public sector, the federal government driving, the policy. There needs to be a dance, and that is hard. But I really do. I hope that the patient percentage increases over time, and I think it will. I think the younger people, and also, I guess it really doesn't matter in the age anymore, but there's a tech literacy issue, there's a technology access issue with all of this as well. But I think people are becoming more comfortable with using a form of technology, whether it's your smartphone or the computer. So.
Yeah, I'm really optimistic about that, in the sense that, in the same way we saw with telemedicine, I think we're in this tremendous crisis, and it is so challenging. But to see people adapt how they consume healthcare with telemedicine gives me hope that all the things we think about as being key barriers to people understanding their patient record, like technology adoption and understanding, may be overcome. Because we've seen it in telemedicine, maybe we'll see it in other places as well.
Yeah, I was surprised a little bit to hear you talk about the patient being responsible for this, though, Mari, or say, expressing an interest in patients taking a more active role in some of these issues. Because I think a lot of people might say the patient de facto ends up doing that, right? Ends up taking their medical record from doctor to doctor if they're going between health systems. I'm curious if you could speak a little bit more about that, because I may have misunderstood, and I'm curious how you see the patients taking on a bigger role in some of these challenges.
I think that if they request to have more access and ownership, and there's always a challenge, right? As a consumer, I'm talking as a patient now. If I were to need, let's say, my mom was diagnosed with cancer, right? Having to go on that journey, God forbid, right? Having to go on that journey to get her records, to take it and bring it to all of the different specialists and, the different appointments. I think if patients and consumers and individuals, we're all healthcare consumers, demand this more seamless ability to move and access the information that we need when we need it, whether it's about ourselves or a loved one or someone we're caring for. I mean, I hope that over time that can be, that is essentially what I was getting at, that I hope that patients and the consumer has a louder voice and a louder sort of drumbeat towards, this is not necessarily our right, but it's our information. So, we should have the ability when appropriate to access it and to be the arbiter of that information.
Right. That's a really interesting point. I want to bring in a question here from a viewer. Matt in Tennessee says, healthcare all too often blames regulation for a lack of innovation. Giving this example of Uber, not working with taxi medallions, it sidestepped it to serve a huge consumer demand. I'm curious if you think that's a relevant example here in healthcare, because obviously we're talking about something very different than taxi cabs, and also sort of to bring up his question, which is where will we see healthcare innovation break through despite seemingly insurmountable regulatory barriers? I think I'd love to hear from maybe Mari first, and then maybe Sanji and Girish if we have time for that.
Got it. So if I'm understanding the question correctly, what are the opportunities for technology breakthroughs? Sorry, Emma.
Yeah, I think his idea was, where could we see this happen? Maybe even people pushing forward despite regulatory barriers.
Got it. Understood. Thank you for clarifying. I would absolutely say, again, with the backdrop of COVID, with this major global public health crisis underway and really not, unfortunately, letting up, quite frankly, for some time, I think there's a tremendous opportunity for social determinants of health, that kind of technology, those kinds of startups, to make a huge play in the industry. I think now more than ever, COVID has really exposed our vulnerable and rural populations. Again, we're getting back to technology access, technology literacy. All of these are major barriers, and I would say that the opportunities are sort of very profound, and I hope ripe for major disruption. So, the opportunities, in my view, around the kind of technology touching on SDOH is, improving that effective communication and education between patients, the family, care team, and sort of the broader community, and to, of course, provide safe and quality care. But also, quite frankly, there are digital strategies and channels to enhance that real-time communication between individuals. So I'm not just talking about doctor to patient, but again, when you think about the social services agencies and organizations that are a part of every community, there's really this earth-shattering opportunity to ensure that circle is closed around an individual, whether it's behavioral, mental, not just physical health. So there's a lot of opportunity there. And, quite frankly, I heard of one just yesterday, an SDOH technology startup. It's called Unblock Health. And the objective of that organization is to level the playing field and demand patient access to critical information needed to make informed, engaged, and empowered decisions about their care. So, there's tremendous opportunity there. And I think it will ultimately improve the health and safety of our communities and regions, because, as we all know, healthcare is local.
Unfortunately, I think we're running out of time here, but thank you so much to our wonderful panelists, Girish, Maury, and Sanji. Thank you so much. You bring such a great, different set of experiences to this conversation, and what a fascinating discussion. I'd also like to thank our attendees for joining the Next Era in Healthcare virtual briefing. We hope you enjoyed the discussion and welcome any feedback. If you can, please complete the brief exit survey that will appear on your screen at the end. Thanks again to our speakers, and we would also like to thank Optum for supporting today's event. You can access the Lasting Impact of Telehealth PDF from Optum in the handout tab located in the Q&A box. And thank you so much for coming. For ongoing COVID-19 coverage and other stories, please go to Bloomberg.com and follow Bloomberg on Twitter at Bloomberg Live and @Business. Thank you.